My name is Dr. Polapat Ronakarin. I'm the head of the Division of Hematology, Faculty of Medicine, Chulalongkorn Hospital. Hematology is the specialty that treats blood diseases, both the cancer and non-cancer. Leukemia, which is the cancer of the blood cells, and lymphoma, which is the cancer of lymph node, and myeloma, which is the cancer of bone marrow that causes the bone diseases. We are the team of many aspects to treatment of cancer, like doctors, we have specialized nurses, social workers, and laboratory technicians. In the future, we plan to have a research team that we can research for the better treatment to the patients. 14-15 years ago, I saw many patients who came with advanced hematological cancer, like leukemia. They are usually young people and very sick at first, but after treatment, they can be cured from this malignant disease. So it's impressed me a lot. I think because of the advance in science, we can directly go to the benefit of the patients that can be treated and even be cured. And also the cost of treatment is very high, and many patients cannot access to this high-cost treatment. So it's our mission that we should research to give them better treatment and more access to the appropriate treatment. Today, the statistics show that the incidence of the hematological cancer rate, like lymphoma, is increasing. It's not only in Thailand, but also worldwide, it's increasing. For the leukemia and myeloma, it is a disease of the elderly. And because the aging populations is increased in Thailand and also all over the world, this incidence of this kind of malignancy is also increasing. The costs are extremely high. It's like for bone marrow transplant, we need at least 1 million baht per case, and some kind of therapy is now in the range of million bahts to treat one patient to be cured. And so many patients in Thailand cannot access to that kind of treatment. Even patients is on treatment, they will not know whether they're going to be cured or not. In Thailand, we are mostly Buddhist. The view of death may be different. We try to think that the death is just we move the house. The house we live is already not good and we have to move to another house. The mind is also important, not only the body. So sometimes we encourage the patients who have enough energy to do so, to try to do the yoga or meditation. So if they think of the good things, they will move to the better places in the future or better next life. Our research came into 3 parts, like to research the mechanism of diseases of this at some molecular levels that hopefully in the future we can prevent the disease. The second part is the early detection. The last one is to test for the patient with the disease to select the appropriate treatment. But the funding from the government is very much depend on the government policy. So sometimes they cut the research budget and going to the other things. So it cannot a reliable source of funding. But this funding from government is already ran out, and we have to need next funding to continue our research in these areas.